health disparities have always existed for the African American community.
Black people are underinsured, underemployed, and barely healthy on a good day.
We have on the line probably one of the most intelligent, one of the smartest, and definitely one of the most beautiful dietitians in the whole wide world.
Come on, Fight Doctor, give it up now. Fight Doctor, you got to say a little bit more because you know where you got to go when you leave the show.
Listen, we have none other on the line joining us to give us some insight on the nutritional aspect of how the coronavirus is affecting the African American community. None other than the lovely, the beautiful, my sweetie, my wife, Miss Toby Jackson. How you doing, dear?
I'm fine.
How are you doing, Miss Jackson?
All right, now don't get on here and embarrass me. You got to let folks know that you're on here for a reason, not just because you know me now.
Hey, I know you don't let him bully you. I know you don't let him bully you at home, and so you ain't gonna get bullied on the show.
No, absolutely.
Hey, but Miss Jackson, thank you for calling in because one of the things that we got to have a serious conversation about is when we look at the disparity of African. I mean, Greg, I think Chicago 30% represent 30% of the population, but when you look at the confirmed cases of COVID-19, it's 70%. But we got to hold up a mirror, man, when we're having this conversation about healthcare disparities, and Ms. Jackson's going to help educate everybody a little bit.
So how important is diet, number one, just in health in general?
So it is extremely important. Pre-existing conditions such as obesity, hypertension, type 2 diabetes, and asthma, they're all basically showing that people with these pre-existing conditions have a worse outcome when it comes to coronavirus. And if you break that down a little bit further and look at each one, I like to specifically talk about obesity. When you look at obesity, it increases the risk for type 2 diabetes, stroke. When you think about hypertension, you think about people having strokes. And then certain types of cancers as well as heart disease. It is preventable. Obesity is preventable. So when you look at that, go back to your diet. Even if you exercise all day long, there will be no optimal weight loss without a caloric deficit, meaning that you have to look at what you're eating. All these bags and boxes and packaged convenience foods, they're really not causing us any benefit. I mean, they're not increasing our health. You have to think about what we need. More fruits and vegetables, more whole grains. Back to the basics.
Now, when you talk about vegetables, make sure that people understand that, yeah, you can have collard greens, but when you start putting fat back and ham hocks and all of that stuff in there, you kind of take away from it. Let's talk about that a little bit.
Yeah, you do. That bad fat, like that saturated fat, that's what it's called. Anything from an animal is saturated fat. Saturated fat increases your cholesterol more than the cholesterol itself in the egg yolk. So when you think about that fat back and anything that you get grease in the pot to make the food taste good, give it a second thought where that fat is coming from. That's the bad heart disease causing fat. You need more of the beneficial fats, nuts, seeds, oils. When you think about plants, think about plant-based diet. That's what we talk about when I educate patients, Mediterranean diet. More of your plants, beans, peas, lentils, to look for that protein, to get that plant-based protein and less of the animal.
Now, what would be an alternative to like your fat back or things like that, or your bacon grease? What would be an alternative for folks who still want to flavor their food? And I'm talking more specifically about African Americans who like their collard greens and their lima beans. What would be an alternative?
So what's wrong with you taking a little bit of onions and sauteing in olive oil? What happened to that?
Ms. Jackson, you can say, we have an expert nutritionist on the line with us. Now help me out, because what I've done is I've cut back on eating a lot of those fried foods. I don't eat a whole lot of the red meat. But can you talk to the audience about how ineffective it is? Because I don't eat right now. I don't because I lowered my intake. I get up in the morning, grab something for breakfast, go to my office, and then look up at 3:00. I haven't eaten all day. So can you speak to that?
That's not good either. Your metabolism slows down when you don't meet your energy demands because it thinks you're in starvation mode. So it conserves. It stores. Everything you eat gets stored because it feels as though you are putting it in a starvation mode. So what you do, I always say, breakfast means break the fast. You break the fast every time you wake up in the morning from a fast and eat. Then your metabolism revs up, and then you eat the right amount for lunch and the right amount for dinner. So make sure you're getting those, those calories from all of your good carbs, your protein, your lean protein, and also your heart-healthy fats. That's where the majority of your, calories come from, your macronutrients, carbohydrates, fats, and protein. How are you going to get it? Breakfast, lunch, and dinner.
Okay, let me break this down for some of the audience listeners that are young people, because I'm processing this, and we appreciate it. But okay, I'm an old man now. Hey, you wait till you get here, and then you say, "Oh, it's time to eat right." So now I don't consume, or my intake is not as great, but I don't eat right. But for young people, you still need to eat right, no matter what.
Oh. Yes, what you do in your younger years, you pay dearly in your older years.
I'm paying now.
That's what I do. I teach pediatric patients, and I see a number of them, 10-year-olds with type 2 diabetes already, on metformin. I see this every single day. And so what I'm telling these kids that are insulin resistant at age 8 with acanthosis nigricans, when you think you have the black dirty neck, you need your mom scrubbing your neck, trying to get the black off your neck, that means you're insulin resistant. What that means is that you need to take a second look at how many calories you're eating, what you're putting out, if you're exercising, and exercise makes insulin work better. And also what you're putting in your mouth, and how much you're putting in your mouth. Back to the saturated fat, back to all the bad carbs like the sodas, the sugar-sweetened beverages, and all of the juices all day long, the Takis, when you think about all of the chips, and nobody's eating fruit, and nobody's eating vegetables. They act like their allergies going on here. Broccoli did them wrong. So you have to kind of think about, every time you eat half the plate, lunch and dinner, dedicate that to non-starchy veggies. Your low-calorie, watery vegetables, broccoli, cauliflower, lettuce, tomatoes, onions, kale, greens. Our food that we eat, listen to me, African Americans and Hispanics, the food that we eat is nutritious. We are not cooking it right all the time, but if you think about what we eat, beans, peas, lentils, collard greens, kale, turnip, these are cancer-fighting foods, full of fiber, beneficial. Cook them right, treat them right, and they'll treat you right.
Well, all right. Greg, I got a question for you.
What's that?
Why we haven't had Mrs. Jackson on the show earlier? Because this education goes a long way. But with that being the case, when people hear about healthcare disparities related to African Americans, the first thing that I've been engaged in, people, they're ready to fight. Saying we're not being treated right, but the not being treated right is coming from us.
That's right.
Yeah, it is.
Well, listen, Ms. Jackson, we really appreciate you calling in. I appreciate you as always, dear, for providing our listening audience with this great information. And you may have just earned yourself a kiss tonight.
Oh, whatever.
Mrs. Jackson, we sincerely appreciate you because this was excellent. But before you go, because I know we got Doc that's waiting to jump in here. But let me ask this piece. We hear about how we're not, treating our bodies right. But I think there's an investment, because you said some things this evening that educated me, a lot further than I'd already known about how we do this. Do you think an investment in terms of educating specific populations would do as well?
It would serve as an excellent benefit, because with that, when you think of obesity and then you look at the CDC, because I often visit the CDC website and just kind of look at statistics. So people who have a higher education, as far as minorities, they tend to have a lower obesity statistic for obesity than people who do not. So educate yourself, getting an education, just merely the knowledge, gaining that knowledge is important for all of us.
Hey, being a friend of the show, can I get you to map out my nutritional diet for me?
What?
I'll follow it now. You just tell me, and I like the fact, eat a lot of greens, but you're cooking this stuff right. I don't know how to do some of this stuff. So I need that education.
Oh yeah. I'm always available. I mean, on my off days, I don't like to talk nutrition, but I will.
Hey, well, we definitely appreciate you. And once again, and please take this with value. What you just said to our listening audience goes a long way.
Yeah, I try to, especially with minorities, because I tell them just by being who you are, Hispanic or Black American, puts you at a higher risk for a lot of these diseases, type 2 diabetes, as well as, we always think about that. Just by being who we are, we can't change who we are, but we can change what we do.